my cervical, spine, and neck evaluation. My paper's there, face down. The papers are on, no cheating. So we're starting off with airway, breathing, and circulation. So I'm going to listen to the patient's breathing, listen for snoring, stridor, and wheezing. Snoring, stridor, and gurgling to make sure the airway is adequate. If I have any of these, I'm going to open up the airway using the proper airway opening technique. Then listening for breathing, make sure they have an adequate rate and adequate intake of air by looking at their chest rise and fall. And then do circulation. For circulation, I'll take a carotid pulse if they're unconscious, and if they're conscious, I'll do a radial pulse. And I'm feeling for strength, rhythm, and rate for that. Next, I'll do a passing person history using questions from sample and OPQRST. Then I'm going to do inspection, looking at the head, neck, and spine for swelling, discoloration, and deformity. And I'm going to move on to bony palpations. I'm going to palpate the spinous processes, which are these big bumps you can see on his back right here. These are the vertebrae. And then I'm going to do the transverse processes, and the occiput, which is this back of the head bone. I'm going to do all those for fractures and subluxations. Then I'll move on to soft tissue. Soft tissue starting off with the trapezius, which goes down the neck to the spine, and it branches out on the back, and continues out further. The extensor paraspinalis muscles, the scalenes, which are on the side of the neck, and then these sternocleidomastoids, you can figure that up, which are these big, and flex it to one side. Like rotate it. No, like this. Look at me. Rotate it. And which are these big muscles that you should be able to see, but you can't really see them that good here. Those are sternocleidomastoids. We're testing all those for strains and contractures. Then we're going to palpate the cartilage and then the lymph nodes, which are on the neck, for enlargement. Next, we move on to special tests. For special tests, the first one we can do is the brachial plexus tension test. So I'm going to hold this right there. Perfect. Like that. Okay. I'm going to hold base hand here, push the head over, and it's going to extend his brachial plexus, which is the nerve in his neck, and I'm testing for tension and compression of the brachial plexus. Next, do the shoulder abduction test. So lift your arm, put it over your shoulder, and rest the back of your head. This is supposed to help test for disc herniation and nerve root impingement. And then the next is the cervical compression test. So I just push down on his head, making sure to go straight down, not push his head in either direction. Push into flexion, push into section, but push straight down through his spine, and that's just pushing straight down through his spine. And that's testing for stenosis and facet irritation. Next is Sperling's test, which is kind of like the brachial plexus test. I'm gonna hold this right here. I'm gonna put his head slightly into flexion, and then and then bend it across, and that's testing for nerve root impingement. And then the next one we have is Oppenheim's test, which is from upper motor lesion, and you start here and you rub a fingernail up on the medial shin. And you also have Babinski's test, also for upper motor lesion, start at the heel and go up. This one you're looking to make sure that their natural reaction is to flex their toes. If they have toe extension and little toe abduction, that's a positive test for upper motor lesion. Next we have a Valsalva test, so put your thumb in your mouth, then blow on it as hard as you can. This puts pressure, this puts pressure on the discs. So it's testing for disc herniation. And then we also have the artery test in the neck. So we don't really have a bench on, but basically so lay down. And what he'd do is his head would fall off the table, and I would hold his head, and I would slowly lower his head into extension. And then with that, I would rotate the head to the left, and that would test for clogs in the right artery. And then I do the same thing, rotate his head to the right. That would test for clogs in the left artery, and you're good now. And a positive test for this is going to be he feels nauseous, he feels lightheaded, but basically not going to go to his brain because there's obviously an occlusion if he's showing those symptoms, which is not a good sign. And then Next, we're going to move on to ranges of motion. So starting off, we can do them actively or passively. You can do them actively. Starting off with flexion, flex your head, flex your neck down. Extension, rotation, left and right. Lateral bending, left and right. Nice. And then now we do these resisted range of motion. So I'm going to apply resistance through each of the ranges of motion to test each of the muscles. So for flexion, I'd put a base hand down, then I'd put my hand on his forehead. And this test, some athletes were going to make the mistake of extending the neck forward. Do you do it like that? But that's not flexion. You really want to have them force their chin down to their neck. So I'm going to put a base hand here, keep it up. And then I have some base hand on the shoulder, but I have a little command also here. And just flexion down to the neck, perfect, calling resistance. This is testing for the sternocleidomastoid muscles and the anterior scalenes. Next we have extension. I'm going to put a base hand on the shoulder, put a hand in the back of his head, and you're going to extend against my hand. Perfect, that's testing for the trapezius, the paraspinalis extensor muscles, and the levator scapulae. Next is rotation, left and right rotation. So I put my hand probably against his cheek or the side of his forehead and have him rotate against me. So here, I'm rotating against me on both directions, left and right. Pulling resistance for each direction. That's testing for the contralateral sternocleidomastoid muscles and the trapezius. Next, the last one is going to be lateral, right and left lateral bending. So I'm going to hold resistance on the side of his head, and he's going to flex or lateral bend against me in both directions. And this one is testing for the ipsilateral paraspinalis, for the ipsilateral scalenes, the paraspinalis, and the sternocleidomastoid muscles. Next, we're going to go through muscle tests. Not muscle tests, nerve tests. We're starting off with motor. So C5 is the deltoid muscles. Can you flex your deltoids? Perfect. C6 is biceps. Can you flex your bicep? C7, can you extend your tricep? Nice. And then C8, can you flex your fingers? Next, we're moving on to sensory. Sensory, C5 is feeling the deltoid. C6 is the thumb. C7 is the middle finger. C8 is the pinky finger. And T1 is the medial elbow. Wait, medial elbow's on this side. Medial elbow over here. Because if he's in an anatomical position, that's the medial elbow. And then we move on to reflex tests. So C5, I'm going to do a brachial tendon test. And then C6 will be a brachioradialis test. And C7 will be a tricep test. And then, so those are, for the tricep test, I can put your arm down, perfect, relax it here. I have his arm relaxed. Then chop, like, if I was holding like this, I'd chop there and expect his arm to flip out. For the for the biceps tendon, I'd hold his arm. He'd be in flexion a little bit. I'd hold it so I'd hold his hand here, and my other hand I'd chop like right there to see if his bicep flexes and bring his arms up. And the brachioradialis, I'd hold his arm again, and I'd chop here and see if his hand has a little flick to it. And then we're going to do a carotid pulse and a radial pulse, doing those bilaterally, and looking for strength, rhythm, and rate for those. And then do a blood pressure, and just the blood pressure, looking to make sure his systolic and diastolic are within normal ranges. And that's the end of my eval. Thank you.